I think that having a team like CPS working with us means that our patients are safer, medicines are delivered in a much more structured manner.
Would you mind just telling us a little bit about Glenlyn Medical Centre? I suppose roughly how many patients you look after and what your role involves in the practice?
My name is Joseph Todd. I'm the Managing Director at Glenlyn Medical Centre, which is a group of medical centres and cardiology service based in northwest Surrey near Borough of East Elmbridge. We look after around 17,000 patients for primary care and anything up to 70,000 for cardiology.
Yeah, it sounds like you're a very big practice. So just if we go back to before CPS started supporting you, do you remember what problems you were facing at the time or what you were trying to solve before working with CPS?
Before working with CPS, we in-housed clinical pharmacists. One of the problems and major problem that we had was maintaining the ability to provide the service across the whole of the year due to leave and to holidays and sickness. Working with CPS enables us to maintain our capability throughout the working year without having any downtime, and it means that our patients are being looked after properly by pharmacists all the way through.
Amazing. And since working with Clinical Pharmacist Solutions, what sort of changes have you noticed? I suppose if we look at sort of workload, patient experience.
So the GP workload in managing prescriptions has gone. The CPS has taken that largely out, and we are able to deliver an entirely pharmacist-led repeat prescription service working with the teams that are based in Glenlyn and CPS. We're able to provide 100% cover for medication reviews. They're always complete. Working with both pharmacists and pharmacy technicians. Medicines reconciliation is always done, and our medicine safety has never been better. The role of the clinical pharmacist in this is to provide leadership and guidance to all members of staff, whether they be doctors, nurses and AMPs in medicines management, and they take a lead on MHRA, shield notifications and alerts, and ensure that our patients are safe 100% of the time.
Amazing, thank you. And in terms of when you was looking for a clinical service provider, do you remember sort of what made Clinical Pharmacist Solutions stand out against the other providers?
Well, Clinical Pharmacy Solutions stood out to us because of the ability to provide that cover throughout the year. Other providers weren't looking to do that. They wanted to essentially employ someone on our behalf, treat them as if they were an employee here. What we asked for was that cover throughout the year so that we don't have a gap in provision. CPS were able to work with us to develop a process of being able to do that. And I think largely successfully throughout the year, we are covered, and it means that we don't have breaks in service. And that's the crucial point. Patients are more demanding. They expect the delivery of the product within the 3 days. I'm pleased to say that on average, we average less than 24 hours to process a prescription request from the patient requesting to the delivery to the pharmacy. And I think that this is certainly top of the tree. Delivery, we can't go faster. So.
Amazing, thank you, Joe. And final question, what would you say to any other sort of practice manager or PCN lead who's thinking about working with Clinical Pharmacist Solutions?
Well, first of all, we can't have my pharmacist and my pharmacy technician, they're mine, and I'm keeping them. But what I would say is that working with a team like CPS means that you are assured where issues are raised, they are dealt with. Where shortfalls arise, such as if someone's off sick, CPS take an active role in managing that. It's not down to me to tell them they sort it before I get there, which is a great weight off my mind because it means I know that I can rely on them to provide that service going through the day. I think that having a team like CPS working with us means that our patients are safer, medicines are delivered in a much more structured manner, and we're able to meet our contractual obligations much more effectively than if we employed in-house. CPS when you look at the figures, you will see that it does offer a cost-effective solution to delivering the care that you need for your practice and the population.
That's great. Thank you so much.